Hello, friends. Welcome all of you to today's session. I'm so excited to see everyone in this platform. As you know, today you are going to have a session on how to approach third-year subjects. Third-year subjects are comparatively simple. And as you all know, we have 4 subjects. We have ENT, Ophthalmology, Forensic Medicine, and Community Medicine. So to prepare you how to approach this subject, we have the faculties from all the 4 departments. So from Forensic Medicine, we have JP sir, Jayaprakash sir. Then from ENT, we have Dr. Rajiv Dhawan sir. From Ophthalmology, we have Dr. Shivani Jain ma'am, and myself, your Community Medicine faculty. So I hope majority of those who are listening are second-year students who are very enthusiastic to get into your third-year subjects, and maybe one of few students who are currently in the third year. Of course, this will be helping you as well. So let's first start from Jayaprakash sir regarding forensic medicine. Let's see what sir has to talk to you about forensic medicine. Over to you, sir.
Okay, thank you, Rajasi. Good evening to all. Good evening, Rajiv as well as Shivani and Rajasi, of course. Forensic medicine, from second year, it has been pushed up to third year. So it is along with ENT, ophthalmology, and community medicine. You know very well what is forensic medicine, application of medical knowledge into the processes of medicine. Once you practice medicine, you should know very well how you have to deal with your patients, how you have to deal with the attendants of the patient, how you have to deal with your fellow colleagues, how you have to deal with the government. Okay. The thing what happens is, most of the time I have seen that forensic medicine students may not be interested much. They think, what is the big deal in forensic medicine? It is not a clinical subject. But listen to me. Do you want to go to prison? I don't think anybody is interested in going to prison. Now you may say, how come I go to prison as a doctor? That is because you should know the law behind your practice. For example, a broad dead case is come to you, 80 years old. Your own patient where you were treated before, relatives ask, doctor, please give me a certificate. You know very well it is a known case of ischemic heart disease. Believing them, he may issue a death certificate stating that he died of myocardial infarction. After 2 days, police will knock your door and they may arrest you. Why? One of own son of that disease must have smothered the person at home for the purpose of property. But you might have believed the other son and given the death certificate stating that it is a natural cause. Automatically you will be arrested and police can book you under even section 302 of IPC for murder, conspiracy with the first son of the deceased. That's why the law you should know very well, number one. Number two, most of the states as of today in India, after MBBS, you are supposed to do 1 year rural service or city or wherever it is. You are supposed to do postmortem examination. I have seen at least minimum 1 or 2 calls or messages I get every day in my Telegram channel or Telegram group asking about the cause of death on postmortem examination. So I tell you, my dear students, don't neglect forensic medicine. We teach legal aspects of medicine, especially study properly about the different types of injuries, the mechanical injuries. Say, for example, I assault a person with the iron rod, Rajiv Dhawan assault a person with a knife. Now, you should be in a position to differentiate which injury is caused by Dhawan or which injury caused by JP. How? People have seen I am having a rod. People have seen Rajiv Dhawan is having a knife. Knife causes incised wound, rod causes lacerated wound. Okay. Tomorrow on the body, if both injuries are incised wound, then definitely it helps me because I never touched him because both are incised wound. Caused by whom? Caused by Dr. Rajiv Dhawan. He may be punished, but not me. But if both are lacerated wound, automatically Rajiv Dhawan's lawyer will defend himself. It is not my client. Okay. And study. The postmortem changes very well. Study what are the different causes of death. Everything you have to study properly. I don't say that you have to study properly about the treatment of toxicology. Strictly speaking, we forensic expert never treat even a single patient. You will do postmortem. But I don't know why it is there in the syllabus. Treatment of cyanide poisoning, treatment of hormone phosphorus poisoning. If at all tomorrow I go on treating patient with hormone phosphorus, the physicians will come and kill me because I am taking away their patients. That's why learn properly the postmortem examination. Along with that, the changes taking place after death. At the same time, what are the different types of injuries? Mechanical injuries, maybe firearm injuries, maybe thermal injuries, maybe road traffic accident injuries. All these things you have to study. Now, lastly, coming to the earlier syllabus and CPME. Frankly telling, because all of you know, all of you, I don't know, I am telling you, I am very, very straightforward person. I tell you frankly, personally, with my 32 years of experience in forensic medicine, I really don't like the present CBME curriculum. All unwanted things they have introduced into the book. That is totally waste. Our traditional teaching of forensic medicine was more than sufficient. But good news is, even today, there is examination by Rajiv Gandhi University of Examination under CBME curriculum. Luckily, the question paper questions were just similar to your earlier paper. So I tell you, and next, the next comes. In next comes importance of if the same pattern is there, anatomy, physiology, biochemistry, pathology, pharmacology, forensic medicine, microbiology. 7 subjects together according to 10%, that is 54. That means you may get about 6 to 7 questions in forensic medicine. If it is so, we don't know, it is not finalized. Okay. Just because it is 5 to 7, don't neglect your UG curriculum. Next is different. Professional exam is different. Professional exam, you study properly, you keep thorough knowledge, not only in my subject, even ENT, ophthalmology, community, medicine, surgery. Thorough knowledge is very, very important. Meantime, many people are tensed. They are tensed about the next. Whether it is next or NEET or whatever it is, it does not make any difference if you have proper knowledge. For example, if foundation is good, you can build your 10 floors, 15 floors, 20 floors of building. If foundation is strong, if foundation not strong, okay, it may bear only 1 or 2 floors. That's all. So, my dear students, nothing to worry about anything. Don't waste your time unnecessarily. Of course, I don't say that you should not enjoy in your life. You can enjoy on Saturday, Sunday, weekends, or whatever it is. But every day, at least 2 hours, 3 hours, you just concentrate on your studies. Never ever take any stress in your life. Okay. Now, we'll talk Rajiv Dhawan, I think now. Or Shivani, we'll be talking. Okay, anybody talk.
So it was a wonderful, yeah, it was a wonderful thing hearing from you, sir.
I want to add on one thing.
Okay, sir.
Before it goes to you, actually, I think by JP sir words, I want to learn forensic one more time, actually.
Yes, sir, exactly same I was about to tell.
He has put
I was about to say the same.
Guys, that's the beauty of this,
Yes.
it's not a formal kind
You
of,
inspired as well, sir.
Sir has beautifully described the importance of the subject in a doctor's life, which because you are big nurse, sir has seen the vast type of scenarios in which a doctor can be trapped due to one or the other thing. So this subject has got a huge relevance in your clinical career also. Rajasi ma'am.
Yes, sir. So that was quite a good information for us as well. So now let's hear from, I know you're all waiting to hear from Dr. Rajiv Dhawan, sir. So, sir, please tell us about what you have to tell us from your side about ENT.
There's to add on to Sir's words on forensic medicine, ENT is a subject with a lot of anatomy over there. And and as an MBBS student, I remember I used to say, what these ENT guys do, there's nothing visible from outside, like everything is, at least eye is visible, outside at least. Everything is inside the cavities. But now I'm in love with those cavities, to be very honest with you. And the important thing is, if your anatomy is clear over here, diseases are superbly interesting and superbly understandable also. And with the endoscopy being so prevalent now in the nasal anatomy, and now with the wonderful microscope available for the otology also, this is very much going to change these subject perception at your level also. And at doctortorials, what we have done is we have inducted a lot of videos within the app also, so that you are able to understand the anatomy and disorders in a very comprehensive way. Guys, my few suggestions to all of you, as you are starting your journey of clinical life. Third year is the beginning of clinical life, actually. Guys, please go to clinical postings. Nobody would really, this is very mandatory. We were discussing with Shivani ma'am also just before the session, that how important it is to really, get exposed to the patient. Otherwise, books, it's like watching a movie versus, reading a novel. And when you watch a movie based on the same novel which you have really read, it becomes very interesting experience. So it's like that. So I think that's a very clear analogy in my mind when I say go to clinics. Clinics is like a way to interact with your colleagues also. That's what actually, and you never know, God may bless you more than that. So you never know. Like that. Third year is a time when you should have a balance between the study and the little bit of like other things also in life. Because doctors I know we are different people. We are blessed souls on the planet, but we have also the right to be happy. Please be happy, doctors. And third year is a time when you put that seed within you. First year, second year, we psych up, anatomy, physiology, biochemistry, and then, pathology, pharmacology. I can imagine that, state of mind, still mind. But now, please create a flair within you. Please attend the college festivals also. If there is a cultural festival going on in the college, in the auditorium, and you're studying in the library reading ENT, I really, believe me, I would not recommend that. Go out.
Nobody is going to do that. I'm sure nobody does that.
Nobody. A lot of people are like in the hostels. They're only studying. Believe me, later on they become very, very inert kind of doctors. And I want third year is a time when you can create a balance. So one suggestion to all of you, you have to. You guys, Rajiv, we are forced to study now. ENT, PSM, forensic. Believe me, we want to join hand with you to make your learning easier, so that you are able to grasp the subject at a very higher level with a lot of clarity in a lesser number of hours, actually. That's what the whole, team is really working on that. We are passionate about making the medicos life easier. And guys, one little bit suggestion, competency codes are very important, because in the future, next exam is being planned. And if what they are saying today, that, individual papers of subjects, it means that you have to know all the competency codes. Please look at that. Your seniors did something. Please don't cut, copy, paste that. You have to, like, for example, salivary glands, esophagus, oral cavity are mandatory part of ENT now as per the new competency codes. So we have to, follow our preparation in such a way that in the future, next exam come, we are prepared for that also. And the one last more thing over here, guys, please finish, one aspect of medicine and one aspect of surgery in third year. I know I'm putting a lot of burden on you. Reason is, when the final year starts, and the next is announced, you will have a lot of things to handle at the time. So what you can do in medicine, had I been a third year student, what I would have done, apart from these 4 subjects, I should have seen the overview of CVS, CNS from medicine, and GIT and genitourinary from surgery. That's all about it. So my curriculum of third year is little beyond third year. Why? Because next exam, right at the tail end of the final year, would not give me much time to revise these subjects also and focus on the main subject like OBGY, medicine, surgery, orthopedics, radiology, anesthesia, psychiatry. I don't want to get overwhelmed. So a little bit of smart thinking is required over there. So take home message. Create a balance between the personal and the other things also. Study and this thing should be balanced out. Number 2, keep that next in mind now. Number 3, go to clinics. Number 4, a little bit of medicine, a little bit of surgery finished now so that we are having more time to revise later on. Over to Rajasi ma'am.
Okay, sir. So that was such a motivating talk. I would say, it was not just how to approach the subjects, but rather it was like how to approach third year. So it's like sir said, it's not just subjects, but this is the time you can enjoy a little bit. You can, little bit freak out and you can have fun. Now now we have our Shivani ma'am. Ma'am, welcome you to the session and please tell us what you have to say from ophthalmology.
Thank you, ma'am, and good evening, everyone. Hello, dear seniors, and it's lovely to be here. Now, as Dr. Rajiv has told us that not only how to study ENT, but he has also given us tips how to enjoy the third year and how to enjoy a medical life. Definitely, guys, third year is one period which is known as honeymoon period, isn't it? Every medico wants to enjoy the third year. He wants to jump onto the third year rather than going through the first and the second year pangs, isn't it? So I was one of them. I also enjoyed thoroughly my third year. Not only I was reading, but also I enrolled myself into extracurricular activities, and not only some extracurricular, but also some things, you know what I mean. So you can enroll yourself into the other things as well. But guys, believe me, third year, those 12 months will not come back. Believe me that this third year part 1 is definitely a wonderful period, but guess
the most beautiful time, right, ma'am?
Exactly. But definitely you do not forget that what is waiting ahead. Waiting ahead is your medicine, surgery, bulky subjects. So those 9 major subjects are there in your third year and part 2. And after that, you just have to give your next part 1. So that is the most important period of your MBBS, I would say. When you are approaching your third year part 1, you are not going to study only these 4 subjects. Isn't it? You must finish, as sir said, you must try to finish at least 50 to 60% of medicine and surgery. Make your schedule as that you have to finish these 4, ENT, Ophtha, PSM and forensic in a stipulated time. Spend last 2 months for these 4 subjects as well, because you have to give your university exam. But what about the rest of those 10 months? So my call is that you have to utilize your time and you have to go with these 3 C's. I tell all my students that believe in these 3 C's only. What is the first C? First C is the consistency. Guys, you have to be consistent. There is no shortcut to success. You have to be consistent. As our JP sir said, that at least spend 2 hours per day to read. Whatever you are doing in your clinics, whatever you are doing throughout the day, fair to 2 hours. Okay, minimum 2 hours you have to read, be it medicine, be it ophthalmology, be it ENT, but you must read at least 2 hours every day. Okay, so you have to be consistent throughout your third year. Enjoy your day, enjoy your time, but still you must read. Now, second C I would say is clinics, as Dr. Rajiv Dhawan has said, and he has enforced that please attend the clinics. Guys, we have seen children coming to us saying, Madam, hum internship mein clinical सीखेंगे. अरे internship में कुछ नहीं सीखना है. You see, you try to learn everything in your clinics itself. So attend your morning lectures, whatever way you can. Read the particular topic, whatever is being told to you in clinic. Suppose if I talk about pterygium. Suppose आज आपने pterygium का case देखा है, ठीक है? Your seniors have told you a pterygium case. So what are you supposed to do? Quickly, in just 5-minute times, open your book. You have Khurana with you every day. So open your book, read the topic pterygium today in the clinic itself. Go back to home, open whatever app you have, whatever source of reading you have. Finish pterygium through and through. It will just take 10 minutes, I'm sure. So that way you will be completing one particular topic. Suppose you are having conjunctiva these days. Okay, let's take an example that you are being taught conjunctiva these days. So attend your lectures of conjunctiva. Read conjunctiva quickly from Khurana. Khurana sir has written a very beautiful book, guys. Very, very useful book for your undergraduation, also for your next level preparation. It's a good book. The newest, the latest edition, sir has worked a lot, and this is a wonderful book. Okay. So read the book. Try to finish out the whole chapter of conjunctiva from the app. Make your own notes if you can. If you cannot, then our notes are available everywhere. So you can take the notes, make the notes as gold standard, write down, add on everything, whatever is told by your seniors or whatever you get to know by doing the MCQs. So finish one topic, take 2-3 days and finish conjunctiva quickly. Okay. This is one thing. So this is the importance of clinic. Now, guys, simultaneously, you will also have postings for medicine surgery. Why not to finish CVS, CNS, GIT throughout, in your third year, part 1? That's a good idea, guys. Believe me, you must do whatever is being taught to you in clinics. Make a list of those topics. Okay. Suppose today you have seen a case of hernia. Why not to finish hernia from whatever source you have? So that time when you finish your, when you finish your third year, part 1, you will be done with your 4 subjects of third year, part 1. Not only that, I'm sure you would be able to finish your 60 to 70% of medicine and surgery as well. Otherwise, guys, I'm telling you, you'll be slogging by the end of second year. लोग डरते हैं, घबरा जाते हैं, they get panic, they get so tense, ma'am. How to finish those 9 subjects, isn't it? So if you take out the burden in your third year, part 1, second year would be very, very easy. And then you develop a love for clinical subjects, isn't it? Otherwise, you will get panic and you will not be able to learn what actually we should learn. The third C, I would say, is clever study. So what is this clever study? Clever study is you should know what exactly has to be done. Make a plan, chalk a plan, and follow it. It's not that everybody can learn everything from those 19 subjects. We cannot. We are humans. So we have to read cleverly. So that is my point. 3 C's again. Be consistent, read every day, attend your C clinics. Very, very important. Finish those topics which are there in your clinics. Either it is medicine or skin or radiology or anything, whatever. So whatever is being taught, you have to finish. You have to do your homework. And the third C, clever study is must. Okay. So that is from my side, ma'am. I think that should be the plan. So the later detailed plan, guys, we can discuss in our further YouTube sessions. We can talk about it, how to study more effectively, how to utilize your time. So we can have more sessions about that as well. Right?
Wonderful. Shivani ma'am really beautifully described,
Yes.
how to approach the subject also. And one thing I would like to share from my own experience this way, guys, please present cases. There are only few people in every sub batch who keep presenting the cases. And I would say, even if, like, for example, in ENT, everyone has to face the long case of CS1, chronic otitis media. Guys, you may not be a good presenter, no problem. That's how we develop this confidence of presenting. Let's do mistakes. I'm a huge proponent of doing things wrong and learning from mistake rather than being perfect in the first go. That gives me more confidence. So each one of you should be presenting cases when you go. Don't let only 2 people present cases only. Okay. You may be having a problem of presenting and all. Don't worry. Within, few months, you'll start feeling confidence. And guys, community medicine is an integral part of every specialty. Like in ENT, we have got National Program of Deafness Control and, oral cavity cancers, head and neck cancers, how to do the prevention. Guys, prevention is a very important part. As you're entering the third year, you are going to become clinician. Please be sensitized towards how we can prevent a disease that the patient need not really reach the doctor for that, ailment. So community medicine is a very important aspect of the career as a doctor. So, and Rajasi ma'am, such a wonderful teacher we have for community medicine. And I would request her to guide us how to approach this subject in the third year.
Sir, thank you very much. As all 3 faculty have already told you how to approach third year and how to do studies, I'll be only concentrating about the subject. So I know out of all the third year subject, the most, the scariest, boring and vast subject would be community medicine. So I think majority who are watching this might be seeing me as the scariest educator, because community medicine is kind of boring for many. But let me tell you one thing, it's a very, very simple subject because it's an amalgamation, like sir said, it's an amalgamation of various other subjects. For example, the major chunk of PARC textbook is diseases and their national programs. For like, you have communicable diseases, non-communicable diseases, which you will learn in medicine. Then we have another chapter on MCH, like, antenatal care, then intranatal care, postnatal care, which is coming under OBG. Then you also learn about immunization, how to immunize a baby, what is the immunization schedule, then what are the vaccines that are available, then how to see a PEM child, then congenital malformations. All these are coming under pediatrics. Then from ENT, like sir has mentioned about deafness control program, then about diphtheria, how to treat diphtheria. Then from ophthalm, we have trachoma, then, vitamin A deficiency. So, and mental health program, which comes under psychiatry. So what I want to tell you is, these are subjects which you have already learned or which you will be learning in final year. In community medicine, we are just teaching you when you're sitting in the community. That means when you are in a health center, whether it is primary health center or, some secondary healthcare like CHC, when you see a patient, how you will approach that patient and how will you manage this case. And apart from all that, so one thing that I want to tell you is, if you really study community medicine, trust me, you will cover a lot of other topics that you are going to see in final year. Okay, so this will be like, half the work done. Okay, and apart from, how to approach a disease in a primary healthcare setting, we will also teach you a little bit of epidemiology. That means how this disease is happening, what are the risk factors, how to control them, and like sir said, like Dr. Rajiv said, how to prevent this disease. Okay, and the second thing, apart from the diseases, are, medical research. Of course, as you all know, medical research is the pillar of modern medicine. And this is something which gives us an edge over other systems of medicine. And under medical research, you have something like study design, case control, cohort. I know you're all familiar with these terms. So we'll be teaching you how to do a medical research. And then we will teach you about the healthcare system in India. So these are the extra things that you learn apart from diseases and other things. And in theory, as per the CBMA guideline, it's mainly the application. Like if you are sitting as a medical officer in a CHC, a patient, say with malaria or a patient with TB is coming to you, how will you treat that patient? And you'll have some sub questions. Then an unimmunized child is coming to you. He's 18 months old. How will you advise the parents? What all vaccination you give? So what I want to tell you is mainly the application. So you first know what are the diseases and those things. And then when you're sitting as a medical officer, how to deal the case is what you are getting in theory. And in practical, as per the CBMA guideline, you will be given a long case. And the case ideally should be from the field. So you will be taken to the field area in your hospital. From there, you will be given a case. That case could be from any subject. Okay, it could be from medicine, it could be from ENT, ophthalmology, any question, any subject. You may get sometimes antenatal, sometimes lactating mother. So you should be able to take that case like you do in clinics. Along with that, the social factors as well, why this disease has happened and how can you prevent it in future. So this is what you're going to learn in community medicine. So it's very, very simple. That's what I want to tell you. Okay. And if you ask me how to approach this, like I said, it's very simple. You have to see in practical. In theory, it's better to start with the previous year questions. So just collect the last 10 years previous year questions from your university. Then you identify which are the topics that are important and you can prepare accordingly. Like Madam said, selective reading. Okay, so that doesn't mean that you have to only stick on to the important topics, but you should also, you have to give more importance to the important topics. And for your practical, apart from this, getting case, you will also have some problem-based questions from statistics, then diet, and then epidemiology. This is all about community medicine. Okay, so I think I've finished about the subjects. It's so simple and I have tried to keep it short. And if you have any doubt, after this, the all faculty will be available for your doubt clearance. Is it not, sir?
Yeah,
We'll
absolutely.
be constantly available, no?
Yeah, you can put the question in the chat box also. Right now, we are seeing that. We'll be able to answer them as well. As Dr. Rajasi ma'am beautifully described the subject. Let me tell you one thing, Bita. As madam opened the her talk with saying that it is a difficult subject, it's a lengthy subject, it's a dry subject. I would say just hear Rajasi ma'am's lectures. Believe me, you will fall in love with the subject, and I can really
I'm
assure you.
already in love with this subject, sir. That is why.
No, you are already, but students will fall in love with the subject
Yeah.
once they hear your videos, because ma'am has really done a beautiful job of making this subject so interesting. And we are lucky to have such a beautiful team over here for the third year, that I feel really proud under the guidance of JP sir. We really are really having a wonderful, team over here. JP sir, I have a question to you, that how doctorals can help the students in this journey of the passing to third year.
Yeah, the thing is, what happened is, as you know very well, for example, in my case, I have recorded the entire video of forensic medicine as per CPMB curriculum. And also there in the video, I have told them which are all the main questions, which are all the short notes, which are not important. And say, for example, in forensic medicine, my videos may be 60 to 70 hours. I don't exactly like, around 60 to 70 hours. Frankly telling, if a person sit 2 hours, he can finish almost one chapter. Okay. And later for the revision, they can go for with speed 1.25 or 1.5. And A to Z images I have given in the curriculum. And as of now, the student, especially after COVID, the students are totally used for online teaching. Always they want, say for example, other day I was telling one student how to preserve the brain. Take out the brain, put it in a bucket of formalin. I told, the students are asking, sir, do you have any videos? What video he wants? He wants me to take the brain and put in the bucket of formalin. I told, come to me, I will give live demonstration. I will drop it to formalin. Then you can feel the formalin, you can smell the formalin, all 5 senses will be satisfied by the formalin. So, what I say is, say for example, Raju or Rajasi or whatever it is, even your subject, you must have taken about 50, 60 hours. Even if you miss a class, offline class, if you miss 1 day, 2 days, 1 week, you miss 5, 6 hours. But online is not like that. Say for example, imagine every day you are traveling to your home in a bus for 1 hour. 1 hour you can open the app and you can study. You are not going to waste your time. So, and also we are giving in a highly reasonable price where it is impossible for anybody else to give in that price. For example, for your birthday, 4 of you go, 28,000 rupees. And one more student, psychology is there. They don't mind spending for cigarette. I don't talk much because everything is recorded. Alcohol or whatever it is. But even tomorrow, if I say forensic medicine app for 500 rupees, people want to share. 5 people want to share. Don't share anything. Let the app be like your own life. Don't share. Okay. So we are giving in a highly reasonable price. Buy it of your own. Go through that, any video. And as you know very well, I don't want to talk about myself because I don't believe in self-boasting. But I know about Shivani, Rajiv, Rajasi, fantastic teachers. You will not feel bored at all. And it is exactly like CPMB curriculum. I myself am very happy about my recording video lectures in my subject. Same voice, what I speak. Same type I have taken in the videos also. For example, as I said, what is forensic medicine? Application of medical knowledge into the processes of law. Like this only I have spoken in the video. So straight away it enters into the ear, from both the ears, and it will be inside your brain.
Absolutely.
Okay? Thank you.
Wonderful. Wonderful, sir. really amazing.
Meantime, I have given MCQs also.
Yeah, that's the wonderful thing. See, guys, the idea what Dr. JP sir is saying, guys, is 21st century going on, and we are at a 5G. You never know where we'll reach by the end of this decade again. With the advent of 5G and with the app-based teaching also being available as one of the resources, we are not saying that textbook or the clinics can be. Nobody can replace clinics. Nobody can replace the medical college environment. That is absolutely. But you know what? We are like humans because we evolved from monkeys over millions of years, and it's everything gives an opportunity also. Right now, there is a huge need of using one more resource, video-based resource, along with the textbook and the clinics or the preventive medicine postings and all. Yes, and life cannot be tough always. For doctors, for medical students, life has been tough. Shivani ma'am must be remembering, when we were reading, we never had that 3D anatomy clear in our mind actually. But now, with the, for example, in ENT, with the endoscopy coming in 2000, whole landscape changed actually, whole understanding changed. For you, we have to make, this is our mission actually. This is I would say our, like as a team, of all specialties of doctorals, we want to make sure that medicals should really enjoy the process of learning. That's very, very important. It cannot be a laborious process because our seniors suffered with that. So what JP sir is saying, that the way JP sir teaches forensic is to inculcate the interest within you. Not it's a burden that I have to finish a subject. You can enjoy the subject too. We can't replace Netflix, but we can create medical Netflix for you to some extent possible. That's what the attempt is. And ophthalmology, Shivani ma'am has done a wonderful, phenomenal job over there. Again, ma'am, how can doctoral resource help our students to learn the subject, to master subject of ophthalmology?
So I'm sure that students across the country, they are aware that Dr. Tutorials is soon launching the 2.0 version. So these are the freshly recorded videos for all subjects. And, we have a clinically oriented approach. And we have done a lot of integrated sessions as well, guys. This is the need of the hour, a lot of integration with all the subjects. Because in the next one exam, you are expected to know about the applied aspects of anatomy. They're not going to ask you straightforward questions. So Dr. Azam, everybody has worked a lot across this, and we have recorded so many integrated videos. The video lectures are also such that it gives you a very clear about idea starting from the anatomy, and we have dealt with every single minute detail according to the new curriculum. Okay, so we have been recording the clinical sessions, we are doing the clinics, we are doing the clinical case studies also, and we are doing everything. We are trying to make things simplified at doc tutorials. Okay, and as sir has told you that this is available at a very, very affordable prices, guys. So why not to take advantage and make things easier for you? So third year, as I said, this is a lovely year, wonderful year. So why not to enjoy medicine? So we at doc tutorials are actually starving to make you people learn, and whatever help is required, we are always available.
Absolutely.
That is
Great.
it.
And my dear friends, I want to make you aware of this thing over there. We have the whole app available, and we do have you can buy like 3-4 subjects together also. That's a freedom plan, because we understand the special needs of special people at the special juncture. Like you are like third year student, you may not be saying I don't want to like take. We have created freedom for you there also. So you go open the app, you can see what are the possible things you can really go for. Rajasi ma'am, I would like to hear from you how the subject recording of your app can help the students.
Like I said, majority of students actually think that community medicine is a very vast and boring subject, but I personally believe, and I really know, that it's a very beautiful, very easy and very simple subject. So in the app, the recordings are done in such a way that I've really enjoyed the recording. So I really love doing the recordings, and I have tried to show the beauty of community medicine, how beautiful is community medicine in the app. So I personally believe that if you listen to the classes that we have in the app, you will see how simple community medicine is, how clear are the concepts. And I really don't know why students are really worried about community medicine. It's so simple and the concepts will be clear. That is what I believe personally. And community medicine, of course, the book is compared to all the other subject books, the third year subject books, community medicine is a huge book, the Park textbook. But the classes are very concise and they are, short duration classes. So I'm not saying that any app is a substitution for your theory classes or your practical session. Of course, you have to go to the college, you have to attend all the practical sessions and theory sessions. But after that, if you listen to the classes which are being taken in the app, definitely that will give you a much clearer idea of what this topic is and how to approach it. So I strongly believe if you listen to the classes, definitely that will help you to clear your exam and in next as well. Because like sir said, we are also discussing the MCQs, which are important for your coming next exam. And in next, as you all know, 10% of questions will be from community medicine for sure. That means public health will be there, 10%, which is a huge chunk that you can expect from community medicine in next. So definitely, if you listen to the classes in doc, that will help you to answer all those 10% of questions that you can expect in next. Wonderful. And we all will be there to help you. Just in case you come across any doubt, we'll be available. I think you have our personal numbers, our WhatsApp numbers, and we have the Telegram groups. So if whenever you feel some difficulty, anything, any problem, you can always approach us. We are all ready to help you out. After all, we are there for you. For that reason only. Okay.
Rajasi ma'am has told one thing very clearly. The team doctorals is passionate about it.
Yes.
We are not just professionals, like teaching is not just a profession here, it's a passion. What's the passion? Passion is to make sure our juniors should start enjoying learning medicine, because this has been a challenge. And we want to change this perception that 19 subjects cannot be handled. But with the beautiful faculty base we have created over here, with the beautiful team we have at the background, we are very sure that we can become very able partner as you proceed towards your journey of learning the clinical sciences and beyond now. And one last thing I would like to say about ENT as a resource. There's again, hidden anatomy can be decoded with endoscopes and the microscopes, and that's what we have really shown over there. We have put the beautiful videos over there in between to show you the endoscopic anatomy. The surgical videos are there. The surgeries have been recorded by the team in the hospital itself, and instrument videos are there. Radiology videos are there. After every chapter, we discuss the certain MCQs, which are designed in keeping in mind the next pattern of question also, so that you are able to see how to put that knowledge to practice also. Eventually, we all want to score good in the examination. Let's not shy away from saying it, because that has got its own value. And so we also know that how to translate this information into your marks. And the passion of the team is so intense that you can see over here. You can see in the voice of JP sir. You can see in the such passionate voices of Rajasi ma'am and Shivani ma'am. And we welcome you all to to this learning process. And we want to join hands with you so that we all progress in making good doctors in this country. That's what the ultimate mission is. This one. Shivani ma'am, any closing comments from your side or JP sir?
Yes, sir. So first of all, I would like to thank everybody, the Rajiv sir, JP sir, Rajasi ma'am, for such a beautiful session. I'm sure the students have seen this and they have enjoyed, and they have been asking us questions as well. And later on also they'll see the video and take advantage of whatever we have suggested. So thank you everyone. Now, as I have said, C, C, C. So I would like to add a D to these 3 C. So add D as doc tutorials, make doc tutorials as a part of your journey of success. That's what I would like to say. So
JP sir, last comment from our beloved JP sir.
Very well. Wish you all the best.
Best of
From all of us.
Yeah. Thank you very much, guys. Thank you very much.
Thank you very much, and enjoy your life at third year. Yeah. And keep studying, be consistent. Okay?
Please follow this channel for further more sessions like this will be coming again to you, so that this journey continues further. So please be with us on this channel so that you are getting updates about other things which are happening on our platform. Thank you very much.
Thank you.
Thank you very much.
Okay, bye-bye. Good night.